Today, we're diving into a really hidden health issue. It's one of those things where the symptoms are so common, you could mistake them for, well, just about anything. A cold, burnout, you name it. But what if the culprit isn't a virus or your crazy workload? What if it's something lurking, unseen in your own home? Yep, we're talking about mold sickness.
Does any of this sound familiar? You've got a cough that just will not go away. Or maybe you're feeling so tired that no amount of sleep seems to make a dent. It's so easy to just chalk it up to stress or, it's that time of year. But what if the real answer isn't something inside your body at all, but all around you, hiding in plain sight, in the very air you're breathing every day?
So how can something just floating in the air mess with us so much? Well, it turns out that mold's impact is way more complicated than just a simple allergy. Okay, so think of it like a three-pronged attack. First, it can act as an allergen, kind of like pollen, making you sneeze and sniffle. Then, it can be a direct irritant to your lungs and skin. But here's the most serious part. Certain molds release these nasty little toxic compounds called mycotoxins. And those can cause problems all over your body.
So, what does that three-pronged attack actually feel like? Let's get into it and start decoding the warning signs your body might be sending you.
It kind of makes sense, right? Since we breathe in mold spores, the first place they cause trouble is often our respiratory system. The tricky part is that these clues are super common, which is exactly why they're so easy to get wrong. The real keyword here is persistent. We're not talking about a cough that you have for a week. We're talking about a nagging, dry cough that sticks around for months, or sinus problems that suddenly become a year-round thing. And for anyone with asthma, it could mean their condition just gets way worse for no apparent reason. It's that relentless pattern that's the real telltale sign. But the body's alarm bells aren't just going off in your lungs. Your largest organ, your skin, and even your eyes are on the front lines too. This is all about direct contact. So we're talking about unexplained rashes, eczema that suddenly flares up, or just that constant feeling of red, itchy, watery eyes. Now, here's the key question to ask yourself. Do these symptoms seem to get worse in one specific place, like your house or your office? If the answer is yes, that could be a huge clue. Okay, this is where mold sickness really shifts from just being annoying to something genuinely concerning. We're moving beyond simple irritation and allergies now, and into the territory of neurological effects. And the main villain here is a word you really need to know: mycotoxins. These are those toxic compounds we mentioned earlier. What makes them so sneaky is their ability to slip right past the blood-brain barrier. That's the protective shield around your brain. And once they're in, they can really start to mess with your cognitive function and your mood. And this is why people dealing with mold sickness so often talk about crippling brain fog, forgetting things, or just not being able to focus. It can even show up as sudden anxiety, mood swings, or depression that doesn't seem to get better with normal treatments. See, it's not all in your head. It could literally be in the air you're breathing. So, does this affect everyone the same way? Not really. While pretty much anyone can get sick from mold, some groups are definitely more vulnerable. We're talking about the very young, whose immune systems are still getting up to speed, and the elderly, whose systems might be winding down. But also, anyone with pre-existing stuff like asthma, severe allergies, or any kind of compromised immune system is at a way higher risk for serious reaction. Okay, enough about the problem, right? Let's talk solutions. How do you actually fight back and get from feeling sick to feeling well again? The path to getting better has two parts, and you have to do both. First, you've got to eliminate the source. Get the mold out of your environment. And second, you have to support your body as it heals and detoxes from all that exposure. Trying to do one without the other just isn't going to cut it. So, step one is all about moisture control. Mold needs water to live, period. So you have to fix leaks right away, try to keep your indoor humidity down, and always use those exhaust fans in the kitchen and bathroom. And here's a really critical rule of thumb. If you're looking at a patch of mold that's bigger than, say, 10 square feet, it's time to call in the pros. Don't try to tackle that yourself. Now, to help your body recover, a doctor might suggest things like antihistamines to help with the symptoms, or maybe even specific detox protocols to help clear out those mycotoxins. But, and this is really, really important, None of this is stuff you should try on your own. The number one most important step is to work with a healthcare provider who gets it, so you can get a treatment plan that's safe and right for you.
Okay, let's wrap this up by clearing the air on a few of the biggest points of confusion and busting some common myths about mold.
This is a big one. How in the world do you tell the difference between seasonal allergies and mold sickness? The real key is looking at timing and triggers. Your seasonal allergies, they come and go with the pollen count in spring or fall. Mold sickness, on the other hand, can be a year-round nightmare that gets noticeably worse when you spend time in a specific building, no matter what the season.
Everyone's heard horror stories about toxic black mold, but here's the truth. Lots of different types of mold, no matter what color they are, green, white, orange, can produce harmful mycotoxins. If you only focus on black mold, you might totally ignore another type that's just as dangerous. The bottom line is, any large amount of mold growing in your home is a problem, period.
So, here's the most important question. Can you get better? And the answer is yes, absolutely. Recovery is totally possible. Once that mold source is gone, most people feel a huge improvement. But you gotta know, it's not always an overnight fix, especially for those neurological symptoms. Patience really is a huge part of the healing process.
This whole topic is such a powerful reminder of how much our immediate surroundings can affect our health. It really leaves us with a bigger question to think about. What other unseen factors in your environment could be impacting your well-being, hiding in plain sight?